Good morning. I'm Council Member Yvette Alexander. I represent Ward 7 in the District of Columbia, and I am the chair of the Committee on Public Services and Consumer Affairs. This is a public hearing, which I'm now calling to order. The date is Wednesday, December the 14th, 2011. The time is approximately 11:10 a.m., and we are in room 412 of the John A. Wilson building. The purpose of today's hearing is to discuss Bill 19-0221, the Regulation of Tattoo Artists and Body Piercing Artists Act of 2011. The stated purpose of the bill is to require the Department of Consumer and Regulatory Affairs to regulate the occupation of tattooing and body piercing in the District of Columbia by establishing and enforcing minimum health, education, and other standards for tattoo artists, body piercing artists, and the establishments in which they operate, and to require the tattoo artists and body piercing artists to obtain a license from and register with the Department of Consumer and Regulatory Affairs. There are several businesses offering tattoo and body piercing services in the District of Columbia today, and a number of tattoo and body piercing artists that are suspected to be working out of their homes or in other facilities. Some of the artists and shops may have implemented their own safety standards or follow the standards used in neighboring jurisdictions, but the body piercing industry remains wholly unregulated in the District of Columbia. Our goal today is to learn as much as we can about the industry and about the safeguards we can put in place to protect our consumers and to provide for a more stable and predictable environment for artists and shop owners in the District of Columbia. We'll hear from various public witnesses today, including the artists, shop owners, and a medical professional about how this bill can affect the industry and about various risks associated with tattooing and body piercing. We'll begin with testimony this morning from our first panel, and it starts with our public witnesses, Dr. Gary Simon. Dr. Gary Simon is the Director of Infectious Disease at George Washington University Medical Faculty Associates, and he's also the Vice Chairman of the Department of Medicine at George Washington University. So if I would like to call up Dr. Simon. Yes, sir. In addition to Dr. Simon, I would like to call up Mr. Matt Jessup. Mr. Matt Jessup is the owner and tattoo artist at Fatty's Custom Tattoos. Is Mr. Jessup here? Mr. Jessup. Mr. Michael Syndrome. Is Mr. Carl Hedgepath here? Come on up, Mr. Hedgepath. Mr. Hedgepath is the owner, tattoo artist, Jinx Proof Tattoos. Matthew Knopp. Mr. Knopp is the owner and tattoo artist of Tattoo Paradise. And I would also like to call up, well, I'll wait since there are three panelists, that's fine. I will allow each of you 5 minutes for your testimony. Dr. Simon, I will allow you to go first, and if I have any questions for you, I will ask your questions as you're on time constraints, and the two gentlemen afterwards, then you can provide your testimony. So you may proceed, Dr. Simon. Thank you so much for taking time out.
Councilmember Alexander, thank you for inviting me. I'm going to focus on tattooing as the issue, and there are several health risks associated with tattooing, most of which can be minimized. We're piercing the body, and if you pierce the body, you run the risk of local infection. You can have a small abscess, you can have cellulitis, which is an infection, a spreading infection of the skin and tissue beneath the skin. And there have been very, very rare cases of things getting more severe, like such as necrotizing fasciitis associated with this. Now, that can be minimized. That can be minimized by cleaning the skin, with a cleanser. Chlorhexidine is probably the best thing to clean the skin with. And you can reduce the likelihood of that occurring by cleaning the skin. However, you can't eliminate it. That's always a risk every time you pierce the skin. In the operating room, we go through a whole procedure to cleanse the skin prior to surgery. But wound infections still occur, and they still occur because even after all that cleansing, there are still small numbers of bacteria on the skin. You can't sterilize the patient, so to speak. The second and most probably well-known or publicized risk is that of blood-borne transmission. Syphilis, hepatitis, HIV infection, as well as a number of other types of infections can be transmitted by blood. Lyme disease, for example, among others. This actually can be virtually eliminated. If you use disposable needles, or if you're not using disposable needles, at least use a needle. When you use the needle, it has to be basically autoclaved, boiled for about 15 minutes or so. Well, you also need to have disposable pigments, so that if you have, let's say, a 4-ounce jar of pigment, you have to take a small portion of that and put it into a separate sterile jar, separate sterile container, and then throw that away after you've used it on the single individual. Because going from patient to patient, even with sterile needles, into the same solution could transmit a blood-borne pathogen. There are a few other things. There are allergies that are associated with some of the pigments. The FDA does not regulate or even know what's in the pigments. They're more concerned with what people put on their skin in terms of cosmetics than what they put under the skin or in the skin. And I won't comment on the logic of that. Some of the pigments, some people can get allergies from them. If there's any nickel in the pigments, a nickel allergy is very common. There is a substance called paraphenylene diamine that's actually used in henna. I don't know if it's used in any tattooing pigment, but paraphenylene diamine can sensitize people to sulfur drugs. And sulfur drugs are fairly important for us in infectious disease. So we would like to not have people allergic to sulfur drugs. And then there's a rare complication. Well, it's not so rare, actually. Some of the pigments contain iron. Now, iron is a paramagnetic substance. It, as you all know, it will react to a magnet. Somebody who has a pigment containing iron who goes into an MRI scanner, a magnetic resonance imaging unit, there are cases of them being burned by it. They've been burned on tattoos, and even there are cases of people who have gotten permanent eyelashes, or eyebrows, I guess it is, and had gotten burns from the MRI scanner as a result of that. Some of these pigments have iron in them. I don't obviously know which ones or whenever. So, yes, there are health risks associated with tattooing. Most of them can be minimized. It's not like tattoos are a small segment of the society. They've become close to mainstream. I think things have to be done to minimize whatever risks there are, but we don't live in a risk-free world. I mean, there are buses on the street and people get hit and so on.
Thank you, Dr. Simon. You mentioned that the FDA does not approve the pigments that are currently for use at
as far as I know, that is not, the FDA does not look at that issue. What's in the pigments?
So the FDA, you said they do approve makeup.
Yes, they do. They look at cosmetics,
but nothing that we inject. And technically, this is a cosmetic use for this. So
I would interpret it that way, but I'm not the FDA.
And you mentioned about the risk of being allergic to or having a negative reaction to sulfur drugs. What are some of the sulfur drugs? What are some examples of that? The most well-known are drugs like Bactrim or Septra. It's trimethoprim sulfamethoxazole is the generic name. Bactrim or Septra are both drugs that are commonly used to treat urinary tract infections. More important to the kinds of work that I do, actually, I tend to see people who are sicker than that. Trimethoprim sulfa is the best drug for treating a type of pneumonia that you see in HIV-infected individuals. Well, before you treat a patient, would you ask them if they have tattoos, or do most physicians ask patients if they have tattoos? And is there a way for doctors to test to see if the tattoo has the nickel or iron?
I don't know of any easy way to test for it. Most people, I don't, usually you examine people, you see if they have a tattoo. We don't usually ask if you have any tattoos.
Do you normally ask them if they have tattoos?
No, I don't. It's something that really didn't occur to me. But then I usually examine people, so I know if they have a tattoo or not. The nickel is an allergic reaction, and so if they're allergic to nickel, they'll know it after they get the tattoo. I mean, it may not be an immediate allergic reaction, but they'll get a reaction. The sulfa is different, and I don't know if that substance is ever used in tattoos. It's used for henna, which can be washed off. It's paraphenylene diamine. And there's no easy way to test for sulfur allergy. It's a different kind of allergy. When people think about allergies to drugs, they think about penicillin allergy, which is a little different from sulfur allergy, in that the immune reaction is differently mediated. Usually we give them the drug and we see if they have a reaction. But it's not an immediate reaction.
What would be the adverse reaction?
To sulfur drugs?
To sulfur. Mm-hmm.
Well, it depends on the individual. In some people, it's a rash. In some people, it's a very bad rash. One time I had a patient who said his eyes turned red. And quite frankly, I never heard of that. So I gave him the drug and had him stay in the clinic, and his eyes turned red. So I didn't give it to him again.
And is there any statistic that you have about any patients who've contracted syphilis or hepatitis or HIV/AIDS?
No, I have no statistics, no data. I would not be surprised if it's ever. Let me say this: I would not be surprised if it has ever happened. That means I suspect it probably has happened at some point, but it's probably quite rare.
And about body piercing, you mentioned about room for infection.
Well, that's always true. That's always true. Even ears can get infected. I mean, most young girls get their ears pierced, and it's pretty benign. But yes, you can get an infection on an earlobe, and it's usually mild. There have been horrible cases, but they're very, very rare.
And you mentioned about an MRI could expose burns for the area.
Yes, in people who have iron tattoos or tattoos whose pigment contains iron, and I think that's used in the permanent eyebrows. There have been reports of people getting burned at that site because it excites the iron and it heats it up in the tattoo. The MRI does that.
So in a nutshell, what I'm hearing, to reduce infection and adverse reactions, the key would be to know what is included in the pigments.
Well, that would certainly help, but those are rare adverse reactions. The major thing is to properly clean the skin and to use disposable needles, use disposable pigments. That is, once you put a needle in that pigment, you're going to dispose of everything that's left after you've done the tattoo. For the tattoo artist to wear gloves and probably or possibly wear a mask, just so by some accident they don't drool into the tattoo. I mean, it's happened. Well, that's why we wear masks in the operating room.
So exactly. So could the same procedure in the operating room, the cleanser that's used on patients before an operation,